of genes. Divorce or abstaining could halt this cancer, but it must be a permanent solution, as the subconscious cannot be fooled. If you have bought a house that has mold or fungus in the walls, or mercury in the paint, your subconscious knows you wish to stay here permanently. Then the body would go to the extreme measures to activate the P53 to initiate change in your destiny through cancer. If the cancer is pH 6.5 or pH 7.5, at cellular level our aim is to restart the Krebs cycle and restore it to its normal state, to activate the Bax gene for the cell to self-destruct, to unfreeze the P53 gene so that the cell can return to normal function and the normal cycle to apoptosis is activated, to stimulate the nucleolus to forget the memory of the attack, which caused the damage to the cell in the first place. When the damage or cancer is to the whole organ, these mentioned methods will not guarantee success. Then our aim would be to find the cause of the cancer and eliminate it by using the 6 senses protocol and ensuring a permanent change of conditions, which the RNA can believe. Observations that we have made are that factors that cause damage to the outer cell membrane range from 1 to 1 million, but they are factors and not cancer. Cancer is a disease caused by an unhappy RNA or intelligence, and the causes must be looked at. Anger or aggression, like chemo or radiation, is never the answer, as it will aggravate the RNA and make it totally immune in one onslaught only. Wrong diagnosis or treatments are also detrimental. Overexposure to chemo results in all red blood cells being destroyed, and ultimately the cancer spreads to the liver, which results in a 99% fatality rate due to organ failure from chemo damage. Radiation kills off the CD4, white blood cells, or immune system, resulting in the body being exposed to any opportunistic pathogen and virus, resulting in early death similar to AIDS. The conclusion that we draw is that treating cancers that have not been exposed to radiation or chemo results in a 90% success rate, but treating cancers that have been exposed have a 97% fatality rate. It would be ideal to have your healthcare practitioner, spiritual advisor, psychologist, best friend, homeopath, naturopath, and nutritionist present when trying to diagnose and treat cancer, as all would have beneficial contributions to make. To study the market for different cures is advisable, but once the chemo or radiation route has been followed, the success rate is drastically reduced. So what is the future of this theory, one might ask? Whilst visual proof and an exceptionally good recovery record in patients making use of the alternative approach to cancer treatment, as set out by Dr. MacDonald, is evident and on record, additionally conducted experimental verification would be required by the medical fraternity, wherein the effects of the RNA disposition theory on cancer treatment is documented for analysis, before this approach would ever find favor with the medical industrial and turnover-based complex. However, in the final analysis, the positive results obtained in cancer patients having used the faith protocols far outweigh the need for profit, and is well supported by those with an open mind and a care for the needs of others. Looking at other diseases that faith drops effectively treat are AIDS, the dreaded disease where the CD4 count drops below 500, making a person HIV positive, going on to ARVs when the CD4 count is 200, often resulting in death due to organ failure from damage caused by the ARV. ARV's function is to make the host virus go to sleep and not eliminating it. Faith drops has the ability to separate the single-stranded RNA of the AIDS virus from the double-stranded human host DNA, also eradicating the viral count, bringing it down to nil within 30 days of taking the product. AIDS, a virus, once entering the body as a single-stranded RNA, takes 24 hours to bind with the body's DNA, creating a host virus which spawns every 11.5 days, making millions of viruses, which in turn eats off the T and B cells of the white blood cell, activating the K cell. This results in a CD4 count drop and a viral count escalation. With faith drops, you will have success in treating the disease. TB, another dreaded disease closely connected to AIDS. many times totally resistant to medication. Patients are put onto TB medication which result in organ failure. Faith drops used with a nebulizer or with a steam protocol eradicates this virus within days. Hepatitis A and B is no match to the drops being taken orally. Jaundice dissipate within hours. Cholera, a waterborne disease killing thousands of people in an epidemic, disappear within hours. Staphylococcus aureus, a hospital or theatre-resistant virus, is killed within 4 days of treatment. Malaria, a parasite that causes brain damage transmitted by mosquitoes, is cured within 3 hours of treatment. In diabetes 1 and 2, the beta cells of the pancreas have been damaged and compromised to no longer release insulin. With the introduction of faith drops, the alpha cells are enabled to convert to perform the beta cells' function in releasing enzymes and insulin for processing glucose in the body. A very successful treatment when used in combination with flaxseed oil and cottage cheese in the daily diet. Parkinson's disease. It is time to stop shaking. Within a week of using faith drops, the substantia nigra, which has been shut down, will restart its release of dopamine, supplying sufficient levels of serotonin to the nervous system to effectively transmit neurosignals again to the body. In combination with daily consumption of vitamin B6 and 12, together with folic acid and magnesium, the neurotransmitting channels are resealed, allowing the smooth return of neuromessaging. The success of Parkinson's treatment is influenced by stress levels, which have to be reduced for long-term good results. The composition of faith also uses the principles of Dr. Masaru Emoto's on vibrational messages from water, which is sent to the RNA through the 70% water in the body. The message you send determines the well-being of the body. Faith is also safe to use by pregnant women, children, and animals. Use the choice you now have. Faith is available now. Visit us on www.cancercure.co.za or www.faithdrops.co.za. With faith drops, the treatment focuses on restoring the Krebs cycle of cells. The different protocols of how faith drops can be administered and how it works, based on the protocol followed, are explained next. Method 1 and 2 require a registered nurse or doctor. Method 1 is direct injection. Take 1 drop of faith, unactivated, to 10 kilograms of body weight. Mix with 20 cc sterile water. Depending on the size of the adult or child, reduce the water according to the body size. 20 cc is for adult, 10 cc for children. Inject directly, intravenously, over a period of 1 minute, which will have the result of the solution sterilizing and killing anything in its path, neutralizing poisons, killing viruses while it passes. This method is aggressive and used only in an emergency as a result of virus or poison infiltration. This emergency treatment should be repeated every half an hour, lasting no more than 1 day. Check for a drop in blood pressure and follow the rules of giving fruit juice to stabilize that. Method 2 is an intravenous drip application. Take 1 drop of faith, unactivated, to 10 kilograms of body weight and mix with 200 milliliters saline solution for infants or people weighing less than 30 kilograms. Above 30 kilograms, a 500 milliliter saline solution can be used. Remember, this is a treatment as effective as method 1, but in a slower ratio, because the IV will enter the body over a period of 1 hour, enabling the solution to penetrate the cell walls and kill off bacteria as well as viruses. Because of the slow ratio, this method also cleans off the interior of the vascular system. It sterilizes the blood and kills off hospital-resistant bugs. This procedure should be repeated not more than 3 times per day for 10 days. Take note, liver function has to be monitored and have a precautionary measure in place after the 5th day, ensuring that the liver ducts are draining correctly. Maintain visual for hepatitis or discoloration of the skin. Method 3 is the oral application. Activate 3 drops of faith and add a cup of tea after 3 minutes. When the solution is in the stomach, it will generate stable